Okay. Do you have a story you would like to share about a patient who had an amazing outcome after being under your care?
Absolutely. So I will tell you that I'm an academic physician. Most of my time, about 70% of my time, is spent doing research and helping others be successful in research. And when I'm not doing research, I'm in the hospital rounding as a consultant. And so that means that I am supporting other clinicians as they care for their patients who have hematologic disorders, in addition to other things that they have. And I'm also helping clinicians who are young, who are in training, grow into their role as clinicians. And so some of that is watching them as they talk to patients, giving them feedback, sometimes when we're in the room, when we're out of the room, and also making sure that they're learning how to really communicate well with the patient. And so one of the stories I want to share is a story of a patient who actually at the time she had had anemia and we were trying to work it up. And she had just recently been pregnant. And so we knew that a lot of it was related to the pregnancy. She had just delivered. We expected her to get better. But we were in the room, we're having a conversation, and all of a sudden the patient stops looking, she stops making eye contact, and her knees start bouncing. And I remember thinking, I was like, the atmosphere of the room has changed. We were having such a great conversation. And I stopped and I said, ma'am, I feel like something is wrong. What's going on? And it was so important because, it wasn't even necessarily related to the underlying disease, but it was communication. And it's one of the most important things that we do as physicians is making sure that the lines of communication are open. And so when we're able to pause and find out that because I said bone marrow, all of a sudden she thought bone marrow equals bone marrow cancer. And she already started thinking that we were worried about her having cancer. And so it was such a beautiful thing to have the luxury of time to actually to be able to sense differences in the way a person is communicating or not communicating, so we can address the things that are going on. So I feel like many of the times my gift to patients is not even so much my knowledge of the disease, because to be honest, there's so much knowledge available, but it's really being able to connect with the person, making sure that they're heard, and making sure that their unspoken questions and concerns are addressed as well.
Wow, that was really good. That was really good. And so basically, so this was an unspoken cue that I noticed because you're just observant. You're pretty phenomenal. I was just listening to you talking about kind of all the multiple hats that you're wearing. So whether it is kind of in academics, and then you're done with the residents and the training, and then you're seeing the patients, and you're not in such a hurry that you're missing kind of the unspoken cues. You saw that, well, she's like, oh God, what's happening to my bone marrow? And you're like, okay, calm down. That's not what we're doing. And so thank you so much. I think on behalf of that patient, I want to actually say thank you so much for just being just the amazing who you are, and just how you're managing to wear all those hats. And you just look so unruffled, and you're there and you're able to give her the time that she needed and to be able to help her through kind of that process. Wow. You're amazing, Dr. Toyosi. I mean, all of you.
Thank you, Dr. Dada. I know that your patients have the same experience as well. And I
Yeah,
think that's one of the
yeah.
gifts I see that you give your patients, because when you have time to talk to your patients, you're able to answer questions that they haven't even asked as well. And so I'm grateful for the service that you provide to your patients.